My name is Amanda Skaggs, and I am a social worker at St. Clair Hospital. We assist with patients being transferred either to other hospitals to higher level of cares or back to their nursing facilities where they're going for short-term rehab or their current resident there. We also assist with patients that are returning back home and they require EMS to get to their residence. Something new that we've been doing a lot is also dialysis. We have a lot of patients that have been requiring EMS to go to dialysis and trying to set up outpatient services for them. Our interaction with EMS is eventful. In the last couple of years, it's been a little bit more chaotic with the pandemic, and we've definitely seen a trend of different struggles that they're having. The delays in transportation can be really difficult for the patients and the staff here. When a patient is waiting to go to the nursing home, they don't always get there timely, so it could be a day or another day delay, and that delays the patient from getting the level of care that they need at the facility. When they're here, we take care of their acute needs, and at the time that they're medically stable, we want to get them back to their rehab. Let's say a patient had a broken hip and they were here, had surgery, and we fixed the hip, but now they need therapy. We can't do therapy every day for these patients, and so every day that we're not getting their therapy delays their recovery time. So that has been something that we've seen a lot, and it really frustrates the patients because they are just kind of sitting here waiting, and their families don't understand because they know how important it is to get them that therapy, but we're all kind of at the mercy of the transportation because the patients require EMS to be transported. Also, patients that are, let's say, having an acute illness and requires a higher level of care, it can be very imperative about the time that we wait to transfer. We had one lady, just an example, had a stroke, and we had a 3-hour window to get her to a stroke center, and the EMSs were at least 4 and 5 hours out. So we ended up thankfully able to fly her out and get her to what she needed. But at that time, it was really scary, and the families and patients, were kind of at the mercy. So it can be very crucial to get patients transferred timely. I could not be more grateful and thankful for the relationship that we have with our community partners. The EMS and the services in this community are just wonderful. We work together, they work together, and we could not do it without them.